Good evening, everyone. Thank you. This represents your paycheck. And that is about how much comes up out of every single one of your paychecks for Social Security and Medicare. 15%, a little over 15% of everything you earn goes to Social Security and Medicare. That means you're working for 6 hours out of every 40-hour week to supply these institutions. Year in and year out, we pay this money, and a lot of times we look at it and ask why. Why are we paying this money into Social Security and Medicare? What are these programs? How are they going to benefit me? Is anything going to be left for me when I get there? Who's eligible for this? What are the health of these institutions? And tonight we're going to look at all of those. We're going to find out what Social Security is and Medicare is by giving you a little bit of the historical background. Getting a lot of talk in the news today about the health of these institutions. We're going to look at that and possibility for reforms. And finally, we're going to look at the responsibilities behind Social Security and our eligibility when it comes to benefits. And this produces a little timeline of the history of Social Security. Social Security Act was created by Franklin Roosevelt in 1935, and it came following the Great Depression of 1929, the market crash. And in 1932, they started putting this together, and in 1935, he had written this into law. There were hundreds, thousands of Americans that became destitute virtually overnight because of the market crash. And this act was implemented in an effort to restore those Americans to dignity. At first, it just covered, Title I just covered the elderly. But Title II gave them actually a pension to go along with that. And then in 1939, they initiated FICA, or that would be otherwise known as the Federal Insurance Contribution Act. And what that did is it also supplied benefits to survivors of people who paid into the Social Security system, and that would be the children, dependents, spouses of people that paid into the system. And the reason Franklin Roosevelt named it the Contribution Act is because he didn't want the negative connotation that goes along with taxes, although the money that goes into the Social Security Trust Fund from our taxes, although the U.S. Treasury Department of Treasury manages that money, it's actually the IRS who regulates that money. And Daniel Bellans, in his History and Politics from the New Deal to the Privatization Debate, which the name of the title of his book pretty much explains it all, was published in August of 2005 by the University of Press of Kansas, tells us also that the roots of socioeconomic concern didn't actually start with Franklin Roosevelt. It started way before that, and they can trace those roots back to the concern that the ancient Greeks had for their citizens, which I thought was pretty interesting. And over the years, it eventually evolved into this. But prior to that, the poor people, the unfortunate, they really had no social welfare program in this country. And in July 30, 1965, according to the American Reference Library publication of the Public Papers of Lyndon B. Johnson, Medicare was signed into law. And that was really important in that it was the first national health care assistance program for people over the age of 65 and over, actually. And what that did is it provided hospital care for those people, the unfortunate, and it also supplemented their medical insurance. Let's see, for people over the age of 65. And then we're going to go to the state of each one of these programs. As I said in the news, we're constantly hearing that Social Security is in trouble and Medicare is in trouble. What are we going to do? The baby boomers are coming along. There's not going to be enough money for everybody else. And this concern not only applies to people who are getting close to collecting their Social Security benefits, but it really applies to the youth of America who are constantly paying into this program, in that they're wondering, is there going to be anything for me? Is this country going to be bankrupt? Are these systems going to be bankrupt by the time it comes time for me to collect? And this is where they're talking a lot about privatization and reform. Although that's another speech in itself because of what just happened in our own market, if it had been privatized right now. Let's see, the annual reports from Social Security and the Medicare Trustees Board that were issued on May 12th of 2009, Phil Mintz of Business Week Online talks about in his article, Recession Hits Social Security Projections. That was written May 13th of 2009. And these reports confirm that the cost of Social Security program will increase more than tax revenue and will exceed tax income starting as early as 2016. Then following that, the Medicare trustees said that the Hospital Insurance Trust Fund does not meet the short-range test of financial adequacy. So that's like the uh-oh for all of us. Where do we go from there? Because payroll tax rates gradually grow larger and larger, and the government is relying more and more heavily on payroll taxes to fund a variety of programs in our country. In an interview on June 17, 2009 with USA Today, Robert Wolf reported that Douglas Elmendorf, who is the Congressional Budget Office Director, he said that there is a tremendous potential to reap savings in the health sector without harming health, but turning that potential into reality is challenging, and that it will be a long, hard slog. And finally, we're going to come to our responsibilities and benefits. Just who's eligible for Social Security? As I said, all along throughout history, there have been several amendments that have been going along with Social Security and enacted to help more and more people in America. And pretty much as it stands right now, virtually every American who has paid into the system has rights to eligibility for benefits. But according to Article 16 of the U.S. Constitution of the United States of America, along with every right comes a duty. And our duty is to pay taxes. Article 16 in the Constitution is located in the rotunda of the National Archives in Washington, D.C. If you'd like to take a look at it, you can refer to that. But it explains that Congress has the ability and the authority to collect taxes from us at any time and for any reason. And it's our hope that in collecting those taxes, we expect to get something back from them. So who does it cover? Thanks to the framers of our Constitution and the other presidents that came along and legislation that enacted our rights for us on our behalves, we're all the people. We're pretty much all covered. It's going to cover us, our dependents in the event anything should happen to us. It will cover us if we're the spouse of somebody who died and paid into Social Security. But not to worry, even though this sounds pretty dark and dismal, Winston Churchill, and I quote, said it best when he said, Americans always do everything right. Oh, gosh. Americans always do everything right, and I can't remember the rest of the quote. Thank you for your attention.